Pain is universal. Every culture, every family, every individual knows what it means to hurt. In our modern world, the ache is compounded by an addiction to pharmaceutical painkillers that numb the body while eroding our health. Chronic pain afflicts more than half of people over 65 in the United States, and opioid overdoses now kill more people than car accidents and suicide combined. Over-the-counter anti-inflammatory drugs, those pills we swallow without a thought, can cause internal bleeding and kidney failure. We face an opioid crisis and an NSAID crisis. Yet at our feet, in gardens and along highways, grow plants that have soothed pain for thousands of years. Their names are whispered in kitchens and written in old herbals. Many are dismissed as weeds by the same industries that sell us pills. This is a story about 20 plants that could replace modern painkillers and the reasons you have not heard their names. Modern medicine focuses on single molecules and patentable products. When a compound cannot be patented, funding dries up. Many of the plants below contain dozens of active constituents that work together to relieve pain. You cannot patent synergy, so pharmaceutical companies pay little attention. Meanwhile, billions of people lack safe, affordable pain relief. The plants on this list are neither mystical nor obscure. They are part of traditional pharmacopoeias across every inhabited continent. Some have been validated in trials. Others have deep traditions and promising preclinical evidence. Together, they offer hope for a safer, more accessible approach to managing pain. Number 1. Willow bark. Nature's original aspirin. Across the temperate world grows a tree that gave us one of the first modern drugs. Willow bark was used in ancient Egypt and Greece for fever and aches, and indigenous peoples of North America brewed it for headaches and arthritic joints. In the 19th century, chemists isolated salicin and turned it into acetyl salicylic acid, the aspirin sold today. But whole willow bark is more than its famous derivative. Studies show that extracts reduce osteoarthritis pain and improve function compared with placebo. Unlike synthetic aspirin, willow bark contains flavonoids and polyphenols that buffer the stomach and reduce bleeding. Yet regulatory agencies classify it as a supplement rather than a medicine, while aspirin reaps pharmaceutical profits. Number 2. Devil's claw, the claw from the Kalahari. In the savannas of southern Africa, a thorny tuber pushes up curved hooks to disperse its seeds. The Khoisan people call it grapple plant. Europeans named it devil's claw. For centuries, healers used the bitter root of Harpagophytum procumbens to treat pain, fever, and digestive disorders. German settlers carried the remedy home, and by the mid-20th century, it was a folk treatment for arthritis across Europe. Modern research reveals that iridoid glycosides in the root suppress inflammatory pathways and induce protective enzymes. Clinical studies report that standardized extracts reduce pain in osteoarthritis of the hip and knee and relieve chronic lower back pain. Because it grows wild and cannot be patented, devil's claw remains in health food shops rather than pharmacies. Number 3. Turmeric. The golden rhizome. Turmeric is more than a spice that stains your fingers yellow. It is a revered medicine from India to Indonesia. Ayurvedic texts prescribed curcuma longa for sprains and inflammation, while Javanese healers used it after childbirth. Curcumin and related compounds in the rhizome are potent anti-inflammatory agents. A recent review of animal and human studies found that curcumin and nanocurcumin significantly reduce pain. Clinical trials in osteoarthritis, rheumatoid arthritis, and post-operative pain report meaningful reductions in pain scores without gastrointestinal harm. The rhizome also modulates mood through serotonin and dopamine pathways. Because curcumin cannot be patented, pharmaceutical interest is minimal, and turmeric is relegated to supplement aisles instead of treatment guidelines. Number 4. Ginger root against inflammatory pain. Ginger has traveled the world's trade routes and kitchens. In traditional Chinese and Ayurvedic medicine, ginger tea warms the body, eases nausea and calms menstrual cramps. Modern science identifies gingerols, shogalls, and paradols as active compounds. They block inflammatory enzymes, act as antioxidants, and desensitize pain fibers. Clinical trials show that ginger reduces pain in menstrual cramps, osteoarthritis, migraines, muscle soreness, and chronic lower back pain. A cup of strong ginger infusion can rival an ibuprofen tablet. Yet mainstream doctors seldom recommend ginger for pain, and it remains a culinary spice with hidden potency. Number 5. Frankincense, resin of reverence. Frankincense, the aromatic resin of Boswellia serrata, was once worth its weight in gold. Caravan traders carried it across Arabia, and it burned in temples from Egypt to Rome. Ayurvedic physicians prescribed Boswellia for arthritis and inflammatory disorders. Modern research found that boswellic acids inhibit inflammatory enzymes and reduce leukotrienes and prostaglandins. In controlled studies, volunteers taking Boswellia extract tolerated more pressure in a pain test than those on placebo, and patients with osteoarthritis reported reduced pain and improved mobility. Yet frankincense's medicinal potential is often relegated to incense and essential oils. Number 6. California poppy. The gentle sedative. When Spanish explorers reached California, they marveled at hillsides glowing orange. Indigenous peoples already knew Ashisholzia californica as a medicine. They chewed the roots for toothaches, applied crushed leaves to wounds, and drank teas to soothe nerves. The plant contains isoquinoline alkaloids that provide mild analgesic and sedative effects by modulating GABA receptors. Tinctures of California poppy were sold for insomnia and nervous headache in the early 20th century. Today, herbalists use it for migraines and musculoskeletal pain. Unlike opioids and benzodiazepines, this poppy calms without causing addiction or respiratory depression. Number 7. Corydalis ancient Chinese analgesic. Among the most powerful natural painkillers in Chinese medicine comes from a modest plant with purple flowers. Corydalis yanhusuo grows in forests and mountains across Asia and appears in a 7th century pharmacopoeia. Modern pharmacology has identified alkaloids such as dihydrocorydaline and levotetrahydropalmitine that relieve acute inflammatory and neuropathic pain without tolerance. Animal studies show these compounds act on dopamine and opioid receptors to reduce pain, yet they do not produce dependence or respiratory depression. Despite its efficacy, Corydalis remains largely unknown outside herbal circles because it cannot be patented. Number 8. Clove spice of anesthesia. In every kitchen sits an analgesic used by dentists for centuries. Clove buds of Syzygium aromaticum contain eugenol, a phenolic compound that numbs tissues and fights infection. In Indonesia and China, clove tea alleviates toothache and digestive discomfort. Experiments show that clove extracts significantly increase pain tolerance in animal tests, and the effect is reversed by naloxone, implying action on opioid pathways. This spice is a natural anesthetic and antiseptic, but its analgesic potential is seldom discussed beyond dentistry. Number 9. Lavender scent of calm and comfort. Lavender fields stretch across Provence and the Mediterranean, but their aroma carries far beyond perfume. Herbalists have long used lavender to ease headaches, anxiety, and insomnia. Its essential oil contains linalool and linolyl acetate, compounds that interact with the limbic system and modulate GABA receptors. In randomized trials, inhaling lavender oil during medical procedures reduced pain scores and anxiety compared with control scents. Yet, mainstream medicine often dismisses aromatherapy as indulgent rather than therapeutic. Number 10. Arnica Mountain Daisy of Relief. High in alpine meadows blooms a yellow daisy called arnica. Shepherds traditionally applied its flowers to bruises and sprains. Modern research validates these uses. Topical arnica gels and creams reduce pain and swelling in musculoskeletal injuries and may serve as adjunct therapy for chronic pain. Active sesquiterpene lactones inhibit inflammatory pathways. Despite this evidence, pharmacies sell arnica mainly as heavily diluted homeopathic remedies instead of standardized extracts that work. Number 11. Peppermint Cool Touch of Menthol. The mint family offers more than fresh breath. Peppermint leaves contain menthol, a terpene that activates cold receptors in the skin and mucosa. Traditional healers rubbed peppermint on sore muscles and temples. Laboratory research shows that menthol diminishes pain behavior induced by chemical, heat, and inflammatory stimuli. Removing the TRPM8 receptor abolishes menthol-induced analgesia, proving that this pathway mediates the effect. Activation of cold receptors triggers endogenous opioid pathways and desensitizes pain fibers. Sports creams and nasal sprays use menthol for its cooling and analgesic properties. Yet few physicians acknowledge peppermint as a medicinal painkiller. Number 12. Kava Polynesian Muscle Relaxer. On islands across the Pacific, social gatherings center around a communal bowl of Piper methysticum. Kava is more than ceremonial drink. It is medicine. Islanders use it to relieve headaches, muscle tension, and anxiety. Cavalactones modulate GABA receptors, block voltage-gated sodium channels, and inhibit inflammatory enzymes. Reviews highlight that kava provides muscle relaxation and pain relief and reduces edema in animal models. Despite centuries of safe use, kava has been vilified because of rare cases of liver toxicity associated with improper preparation. Pharmaceutical companies show little interest in a root that cannot be patented and is freely consumed by villagers. Number 13. Meadowsweet Queen of the Meadow, Filipendula. Ulmaria, known as Meadowsweet, is a meadow wildflower of Europe and Asia. Medieval herbalists revered it for treating fevers and gout. Meadowsweet contains salicylic acid derivatives, flavonoids, and tannins. Reviews note that its anti-inflammatory and analgesic activities made it a folk remedy for rheumatism and gout, and that its effects are due to salicylates and flavonoids. Like willow, it inspired the development of aspirin, yet today it blooms uncelebrated in damp meadows while synthetic salicylates fill pharmacies. Number 14. Cannabis Stigmatized Analgesic. Cannabis has been medicine, fiber, and sacrament for millennia. Ancient Chinese texts describe using hemp seed and flowers for pain, and Ayurvedic doctors mixed cannabis with milk as an anesthetic. Western physicians used cannabis tincture for labor pains and neuralgia in the 19th century. Modern science explains why. Cannabinoids interact with the body's endocannabinoid system. Tetrahydrocannabinol acts on CB1 receptors to produce analgesia, muscle relaxation, and euphoria. Cannabidiol modulates CB2 receptors and reduces inflammatory cytokines. Reviews find that cannabinoids produce a modest reduction in pain compared with placebo and reduce neuropathic pain in a dose-dependent manner. Yet cannabis remains illegal or tightly regulated in many countries, while pharmaceutical companies patent synthetic cannabinoids. Number 15. Capsaicin fire that numbs chili peppers set. Your mouth on fire? But that burn can lead to relief. Capsaicin binds to TRPV1 receptors on pain-sensing neurons, causing an intense heat, followed by desensitization. Indigenous peoples rubbed chili paste on aching joints and toothaches. Today, capsaicin patches are prescribed for neuropathic pain. Analyses show that high-strength patches reduce pain scores by nearly half and allow many patients to reduce other medications. Capsaicin depletes substance P from nerve endings, reducing pain transmission for months. Because the active ingredient is a simple molecule found in peppers, profits are limited, and many doctors still choose opioids instead. Number 16. Feverfew headache, herb. Feverfew is a daisy-like plant that has grown in European gardens since antiquity. Greek physician Dioscorides recommended it for fever and inflammation. In the 1970s, British families rediscovered feverfew for migraines. Controlled studies show that feverfew extract can reduce the frequency and intensity of migraine attacks, and that a combination of feverfew and ginger can prevent mild headaches from escalating. The active compound parthenolide inhibits inflammatory pathways, but some trials show no difference compared with placebo. Bitterness and the potential for allergic reactions have limited its popularity, while pharmaceutical companies offer triptans and ergot derivatives instead. Number 17. Chamomile. Gentle healer, chamomile tea is synonymous with relaxation. The daisy-like flowers of Matricaria chamomilla have been brewed for digestive complaints, anxiety, and insomnia for centuries across Europe, the Middle East, and the Americas. Systematic reviews suggest chamomile may also relieve musculoskeletal pain. Its constituents, including apigenin, bisabolol, and chamazoline, modulate inflammatory enzymes and GABA receptors. Because it is safe and gentle, chamomile is often dismissed as too weak for serious pain, yet millions rely on it when they cannot tolerate stronger drugs. Number 18. Rosemary, memory, and relief. The evergreen shrub. Rosmarinus officinalis has a long history of culinary and medicinal use around the Mediterranean. Students in ancient Greece wore rosemary wreaths to sharpen memory, and healers used rosemary oil for headaches and muscle aches. Reviews of rosemary's effects note that it is used as a mild analgesic for neuralgia, headaches, migraines, and stomach aches, and highlight its anti-nociceptive and neuroprotective properties. Active compounds such as carnosic acid and rosmarinic acid modulate GABA and cholinergic receptors and inhibit pro-inflammatory molecules. Despite this, its therapeutic potential is rarely acknowledged by modern practitioners. Number 19. Passion flower vine that soothes. The intricate blossoms of Passiflora incarnata captivated Spanish missionaries in the Americas who saw symbols of the Passion of Christ. Native peoples of the southeastern United States valued the leaves for anxiety, insomnia, and pain. Passion flower contains flavonoids and alkaloids that modulate GABA and opioid receptors. Extracts of the plant produce significant anti-nociceptive effects in neuropathic pain models comparable to pharmaceutical drugs. The analgesia involves both opioidergic and GABAergic pathways. Traditional doses soothe nerve pain and menstrual cramps without causing dependence. Nevertheless, passion flower is marketed mainly as a mild sleep aid rather than a serious analgesic. Number 20. Black sage Chumash medicine. On the dry hills of California grows a shrub with sticky leaves and a pungent scent. Black sage, Salvia mellifera. For centuries, the Chumash people made a sun tea from its leaves and stems and used it as a foot soak to treat chronic pain. Monoterpenoids and deuterpenoids in black sage penetrate the skin and interrupt the pain chemokine cycle that sustains chronic pain. Case reports describe patients with chronic back and cancer pain experiencing long-term relief after using black sage preparations. A topical liniment made from related sagebrush contains cineol, reported to be more powerful than morphine when applied to broken bones and gunshot wounds. Today, chronic pain is often treated with systemic opioids that cause dependence and death. Topical treatments like black sage could save lives if they were researched and standardized rather than dismissed as folklore. Why don't we use these plants? Standardizing botanical medicines is challenging because chemical composition varies with soil, climate, and processing. Clinical trials on multi-compound extracts are expensive and regulatory pathways favor single molecules. You cannot patent a plant that grows in a ditch, so pharmaceutical companies invest in drugs they can monopolize. Research on botanical analgesics comes from small academic labs and is underfunded. Regulatory agencies treat herbs as supplements, allowing products of variable quality to flood the market, undermining confidence among physicians and patients. Many of these plants are stigmatized as weeds or narcotics. Cannabis is criminalized. Black sage and feverfew are considered invasive. Willow is cut down. We spray herbicides on analgesics growing in our yards. Yet change is coming. The antibiotic crisis taught us that drug pipelines can run dry. The analgesic crisis is upon us as opioids and NSAIDs damage organs and take lives. Interest in integrative medicine is rising, and people are questioning why ancient remedies with scientific support remain marginal. Indigenous communities are reclaiming knowledge and sharing it. Scientists are using modern tools to study complex plant extracts, and some governments are legalizing herbs like cannabis and kava. There is hope that the 20 plants discussed here, willow bark, devil's claw, turmeric, ginger, frankincense, California poppy, Corydalis, clove, lavender, arnica, peppermint, kava, Meadowsweet, cannabis, capsaicin, feverfew, chamomile, rosemary, passionflower, and black sage will move from the fringes into mainstream pain management. These plants cannot speak, but their presence is loud. They grow through cracks in sidewalks and thrive in neglected fields. They offer relief to those who listen. As Alexander Fleming once warned of antibiotic resistance, we must also heed the warning of analgesic dependence. Exploring the plants that have always been with us does not mean rejecting modern medicine. It means broadening it. If we integrate these ancient allies with rigorous science, we may finally ease humanity's oldest suffering.